than anyone else.
House Majority Whip James Clyburn, Democrat from South Carolina, will be attending tomorrow's health care summit. Sir, we're pleased you're joining us this morning. Do you agree with your Republican counterpart that Speaker Pelosi doesn't have the votes? Because I've heard you say, in fact, you think there might be more votes.
Well, thank you very much for having me. First of all, let me say that Mr. Cantor seemed to be treating the president's proposals as a bill. These are the president's proposals laid out before us, asking all of us to come to the table on tomorrow, and if we like what we see, then accept it. If we don't like it, offer modifications, and how can we improve it? And then we'll start determining whether or not we've got the votes. We don't have the votes for a proposal. I think we will have the votes for a good bill, and we're not there yet. So Mr. Cantor really ought to get serious about having a discussion about what it is that they will do to improve upon the president's marker.
So you say these are just proposals. We know they've broken it down into 4 specific areas. Do you think you can get it done then if these are just the proposals?
Yes, I think we can get a good bill, and I would hope that my Republican friends will offer their suggestions, help us make the modifications they think are necessary, add to it if we want to, offer suggestions as to how we can take away from what the president has laid down. These are good, solid proposals coming from the president, asking us as members of Congress to offer our suggestions, and then we'll see whether or not the votes are there. And so I'm not doing any whipping now on proposals. I'm waiting on legislation to start my whipping process.
Assuming then, sir, that there is legislation, you've also been vocal about reconciliation, as we heard Senator Reid in that soundbite at the top of this segment. You've supported him on that. You've said it's a good option to get the bill through. But Republicans say, hey, that just defies the will of the voters who have opposed your plan.
Well, you know, it's kind of interesting. It's been 28 years now that we have been using reconciliation for health care bills. I would remind my Republican friends that we did welfare reform under Bill Clinton with reconciliation. We did Bush's tax cuts under George W. Bush with reconciliation. We have used reconciliation almost 30 times to get things done of this nature. This is ordinary activity in the House. There's nothing extraordinary about using a budget reconciliation. I've always said the welfare reform, it was good for welfare reform, it's good for health care reform.
All right. Well, we hope we see something extraordinary tomorrow. Congressman, appreciate your time, sir.
Thank you so much for having me.
Stick with MSNBC. We'll have special coverage of that health care